our series, or Epilepsy in Education series. My name is Clara Sherlock and I'm a PhD student with the UCD Neuropsychology Lab, and I'm also a Penny research team member. So for those of you who aren't familiar with Penny, Penny is the project on educational and neuropsychological outcomes of children with neurological disorders in Ireland. And it's a collaboration between CHI at Temple Street and the School of Psychology here in UCD. It's our latest study as part of this research team, which is looking to track outcomes of childhood epilepsy in Ireland and the UK, and to capture the lived experience of epilepsy in Ireland that has inspired this webinar series. So we're thrilled to have so many of you with us today, to have an opportunity to listen to people with epilepsy share their experiences, and also to continue the conversation on how best to support both people with epilepsy and those who support people with epilepsy in education. So to get started, we have three fantastic speakers for you here today. So to start us off, I will introduce Associate Professor Christine Linehan. So Christine is the Director for the Centre for Disability Services here in UCD, and I will mute myself while she gets going.
Hi, Clara. Thanks for the introduction there, and welcome to everybody. It's terrific to see so many people taking time out of their lunch. I hope we're not separating you from your sandwiches, but thank you for attending. It's terrific. I'm just going to say a brief hello, really. As Clara said, I'm the Director of the UCD Centre for Disability Studies. So we have a master's programme in disability, we do CPD in disability, and we conduct quite an amount of research on disability, a lot of which is international as well as national. I'm probably here in my capacity as one of Clara's supervisors for her PhD. So any of you who have done a PhD will know the pain of that. And Clara's co-supervisor is Dr. Michelle Downs. So some of you may know Michelle for her work with children and epilepsy. She does a lot of research in that area. So we're Clara's supervisors. My own PhD was in this area. So my PhD tried to determine the prevalence of epilepsy in Ireland. And we estimated that about 8 in every 1,000 people in the country has epilepsy. And in fact, 10 in every 1,000 people at some point in their life had epilepsy. And the number that we had was about 37,000, but with the population increasing, that figure is increasing all the time. So my work is sometimes around definitional issues of epilepsy, which we won't be looking at today. And I do a lot of work with the International League Against Epilepsy. So some of you might be familiar with that. It is kind of the premier association for epilepsy internationally. And I chair the task force on intellectual disability and epilepsy. So I'm sure that some of the issues here will be pertinent for people with intellectual disability as well as the general population. The one thing when I hand over to our speakers, I suppose I'd very much like to welcome Danielle and Joyce. I think we have two terrific speakers today, and I'm immensely grateful to them for taking time out to do this. But I also would like to call on everybody else here, and that is that at some point in this seminar, it will be lovely to hear your voice. So the speakers have gone to a lot of trouble in what they're going to present on, but I think with these, a lot of the essence that you get out of this is not only from the speakers, but also from your own contribution. So get the vocal cords going, and maybe you'd contribute to the discussion later on. I see Michelle there. Michelle, you might give a wave, seeing as I mentioned it. So I'm sure many of you will know Michelle's name there. Clara, I'll hand back to you now.
Thanks, Amanda, Christine, thank you. So we'll carry on with our expert by experience, Danielle Rourke. So Danielle has very graciously given us her time today to share a bit about her epilepsy journey and her experiences with epilepsy in education. So I'll mute myself and allow Danielle the floor.
Hi everyone, my name's Danielle and I'm 25. Excuse the background. I started teaching like 3 weeks ago, so I had to use a classroom that's like half broken down, so it's not the best background. But yeah, so I was talking to Clara a couple of months ago. So I have like a condensed version of what we talked about. So I got epilepsy originally on my first day of secondary school, so it wasn't a great start. So I was in the middle of Spanish class, and then I had a seizure, and my teacher ran out of the room crying. So it was not like the best start at all to school. And then an ambulance came, and it was a really big deal. And I missed like the first 2 weeks, which is obviously pretty prime when you're like 12 or 13. So kind of from the offset, I guess I was always kind of self-conscious when I was in school, because I knew everybody in school knew about it because it was an ambulance, and that doesn't really happen every day. So then I went back to school, and I think that I never really like fit in until the transition year anyway. So like for the first 3 years when I was in that same class, I constantly was like self-conscious that everyone knew I had epilepsy, and that they might be afraid to be friends with me a bit, because no one like that's 12 or 13 really understands what seizures are, or like knows like how to deal with it. So I guess it is pretty scary if you see it and you don't know what one is. So because I used to get them in class all the time, I always seemed to get them in science, and I hated science, so maybe it was something to do with the subject. But yeah, my mom was a very regular visitor to the school. And yeah, either a lot of people didn't have seizures. I was one of the only people that seemed to have seizures like constantly in school. And yeah, so that was kind of always a pretty big thing. And then I obviously started having medication. So I have tonic-clonic epilepsy, but I was originally diagnosed with the wrong type of epilepsy by a doctor. I'm not going to say their name, but then I got Dr. Amri, and he is like my favorite person in the world. He was the first person I had a crush on because I was just like obsessed. So he figured out the type of epilepsy I had. And he used to always say that everyone got 20-minute appointments, but I got 40 minutes because I was his favorite. So yeah, me and my mom were obsessed with them. And like she went through her hysterics because she was so stressed out, and he was so good at dealing with it. And one of the times I think I tried almost every type of medication possible, every combination, and it just wasn't working. And she screamed, "What are you feeding her, Smarties?" And like I felt so bad for him, but he dealt with it really well. But eventually I ended up getting Epilum, which is, we always call it the magic bullet cure, because as soon as I had it, the seizures stopped. So when I was 15, I stopped getting seizures, which was amazing. And obviously everyone probably knows there's so many side effects to Epilum that obviously aren't ideal, especially at my age, and kind of the hospital keeps reminding me of that. But yeah, it worked at the time, and that was all I kind of cared about, because I just wanted to not be having seizures anymore. So I basically stopped getting them at 15, but I always kind of felt like I was left behind, like in the beginning of school, and like I guess I kind of always had a chip on my shoulder about it. And I guess, yeah, I felt bad for myself, and at the time, like I couldn't understand why I got it and no one else did. And like obviously it's just bad luck. But yeah, so then in fourth year I kind of like came into myself a little bit more, because I was like, this is a new start. But I always kind of had like a lack of self-esteem, and then I had a lot of side effects to Epilum, or not to Epilum, just kind of, it was like once I got fixed on tablets, I got Tourette's then, and then I used to get like zone outs and double vision, and kind of a few of those typical side effects, but the school never really understood it because they obviously knew what a seizure was, and that is pretty obvious, but all the side effects, like, people don't understand. So like I'd get like double vision in class and not be able to see the board properly, but they'd just be like, you weren't concentrating. And so I just got self-conscious about like talking about the effects, and then I was like, maybe I'm being dramatic, because they kind of, I guess, dismissed them a little. So yeah, there was like a year or two of those effects that weren't ideal. So, and then I was always nervous and like self-conscious around new people and stuff, and especially because that's when you're making like new friends, boys, everything. So it was always something that kind of held me back. And then the way people didn't really know how to go about it kind of like knocked down my self-esteem a bit, I guess, as well. And then, yeah, there was just such a lack of knowledge of what epilepsy was. So when I was in fourth year, I actually did a presentation to my year about what epilepsy was and how like it's not like this big scary thing. And then I talked about like all like famous people who had it and stuff, and everyone was like, wow, we can't believe you actually did that for everyone. And another girl in my year actually that had epilepsy, that had been afraid to say it, was like to me, I have epilepsy too. But it's just like such a stigma. Well, I don't think there's as much of a stigma now, even within like 10 years. But at the time, I think like it was just like made such a big deal of that no one wanted that spotlight on them. And no one wanted to be known as the person that has epilepsy either. So yeah, then the leaving cert, like, I feel like because I missed parts of school sometimes, because sometimes I wouldn't go in because I just get really bad side effects or really like panicked, that like I missed out. And like I know that there's some new implementations for people that have epilepsy that are doing the junior and leaving cert, but I feel like I definitely kind of, they didn't have like the proper support. Like there's a generic support for everyone that has disability, but I feel like it's not specified to the exact circumstances that people have. So it doesn't always kind of work for everyone. So yeah, then I went to college, to DCU. And once I went to DCU, like it was a new start. So I was kind of, it, in hindsight, for years, and I was fine. Like obviously it wasn't ideal, but I got over it. So yeah, then I went to college. I went on Erasmus to Austria. I had the best year of my life. I went volunteering to Vietnam and Honduras, and now I'm teaching English in a TEFL school. So I feel like it definitely, the probably frustration I had in school showed me that like obviously people don't always understand things properly. And I feel like, especially because there's no education about it to teachers. Well, there's probably a little, but not enough, or to students. So then yeah, when I was in college, I kind of did different epilepsy fundraisers and stuff to raise awareness more. But yeah, I don't know if anyone has any questions. I don't know if I said the exact right things.
That's fantastic, Danielle. Thank you so much. It's so important to have, as I say, an expert by experience with us. So thank you so much for your time and sharing your story. And we might save the questions to the end. If anybody has questions, you can pop them in the chat. Maybe you might send them directly to me, just so we're not distracted by questions popping up all the time. But other than that, what I might do is I'll pass on to our next speaker, which is Dr. Joyce Senior. So I just might mute you there, Danielle. And we'll have Joyce sharing her screen. So Joyce is the director of the Professional Doctorate in Education Psychology here in UCD, amongst many other things. So I'll let her tell you a bit about those herself.
Just going to unmute myself first. The unmute button disappeared behind the PowerPoint. 1 sec. No. Get this. Okay. Okay. Can everyone see that? Yeah. Okay. Okay. So thank you, Danielle. It was really interesting listening to your experience, and I was kind of nodding away with so many of the things that you said. I mean, I think the word that stood out for me was generic, and I think that is so applicable in terms of education system. Too many of the supports are generic, and you know they're just not specific enough for students with epilepsy. So just I suppose to introduce myself, my name is Joyce Senior. I'm an education psychologist. I have a teaching background. I have lived with epilepsy with family members. And it's an area that I'm really passionate about, and particularly in relation to the needs of students with epilepsy in the education system. Like again and again, parents with epilepsy say to me that it's the educational and the behavioral difficulties, and in particular navigating the school system, that's much more challenging and time consuming for them than the actual epilepsy, the seizures and the medical management. And again, Danielle, I was struck with, you know, giving insight into the experience of your mum and being so stressed out. And that is absolutely the story for a lot of parents, trying their best to navigate an educational system and a medical system, and you know, maybe a mental health system. So it's very difficult for families and for parents. You know, while again, you know, you referred to stigma there, and I think things have definitely improved. School personnel have, you know, they may have a basic understanding of epilepsy and seizures and the related safety concerns, but they're less well informed about how it may relate to an impact on a child's learning and their emotional and behavioral and social adjustment. For example, you know, there may be genuine concern over a child's physical safety in the schoolyard or the class yard, and that may supersede that of the concern over their, you know, their social functioning and their friendships and their quality of life. And I think furthermore, the learning and the behavioral issues specifically associated with epilepsy, they may not be clearly understood or are viewed as unrelated to the epilepsy. And that can lead to inappropriate supports and even inappropriate class and school placement. And you know, this is particularly important if, you know, during a difficult period that a child may be going through, for example, increased seizure activity or a change in type or in dosage of anti-epileptic drugs. So this following presentation will give a very brief overview of the key areas and the challenges that children with epilepsy may experience. And really, it's a whistle-stop tour within the time constraints. But the key areas that I'm going to look at are kind of learning, academic, emotion and behavior, social inclusion, school-based supports. Okay. So why is it important to look at the experience and to know about the experience of children with epilepsy? And one of the most important factors is relating to prevalence. And in fact, it was Christine who did the only prevalence study in Ireland. And it's even like a survey which was conducted by Epilepsy Ireland as recently as 2021. People seem to think that epilepsy is quite rare, and that 87% of the respondents significantly underestimated the prevalence of epilepsy in Ireland. And I think more concerningly, 4 in 10 said that they'd no knowledge of epilepsy. And if you think about that in the context of the school system, that there's at least 2 in 100 children have epilepsy. And when I work with schools and teachers, you know, I would say to them, you know, in your experience, how many students have you taught or supported with epilepsy? And it always surprises me how low the numbers are. But that is because they don't know that they have students with epilepsy in their schools. Because when you tell them, well, think of the size of your school and there's at least 2 in 100, then they start to realize actually there are children there that they don't know about. And that can be for a variety of reasons. It may be parental choice that they don't want to share this information with the school. Or it can be that the seizures are stopped or resolved and they think, oh, well, that was a few years ago, that doesn't matter now. And they don't realize the impact, the potential longer term impact on education and attainment and cognition and behavior. So they don't tell the school. But, in fact, 30% of children with epilepsy have a cognitive impairment or a cognitive disability. And 50 to 60% have additional needs and may require additional support. So when you think of that in terms of the school population, it is significant to know what the prevalence is and actually to be aware that there are more children in our schools with needs related to epilepsy than we realize. And again, Danielle, you refer to stigma and that you don't, it's not as prevalent. And I absolutely agree. And I think since I started working this area, over 20 years ago, it has definitely improved. I think in understanding and knowledge of epilepsy has developed, but there still is stigma. And that can be, from the perspective of a parent who really doesn't feel comfortable informing a school, and they would use the words such as disclose and think, it shouldn't be about disclosing, it should be about being comfortable to share this information. And this study that was done with students from 16 countries, they reported that they felt epilepsy would have a negative impact on their life and limit education. 36% of them didn't want their schools or their peers to know. And more worryingly, 73% felt that it would have a negative impact on their employment opportunities. So in terms of school difficulties, as I said, again and again, people with epilepsy and their parents, they say to me, it's actually the school difficulties is their greatest concern. And that it's the cognitive and learning problems that may present as a greater challenge than the actual seizures themselves. So just to go through, briefly in terms of what are the cognitive and the academic considerations or factors. So this is a large study known as the CHESS study, Children with Epilepsy in Sussex Schools. And it investigated the prevalence and the nature of learning and behavioural difficulties among school-going children with active epilepsy. 79% of the parents and 67% of the teachers reported difficulties with academic progress. And it really provided very clear evidence that children with epilepsy have a higher rate of difficulties in relation to cognition and behaviour. And again, what was worrying was that these difficulties were often not recognised prior to the psychological assessment, which each child had as part of this study, even though they were clearly having an impact on their academic progress and their overall quality of life. But there had been no assessment to actually formally identify what the nature of those difficulties were. What the CHESS study found that 55% reported cognitive impairment, 40% had a learning disability, 58% had memory difficulties, 61% processing difficulties, and 60% behavioural difficulties. So in terms of the kind of what I call the cognitive profiles or the underlying needs, and anyone who has epilepsy or who has worked with students with epilepsy would very readily say, yes, attention and concentration are majorly affected, as is memory, working memory, short-term memory, visual memory, which is a huge impact on quite a lot of aspects. So if you think about even learning your spellings, that really depends on having a good working and visual memory. Problem solving, absolutely, maths, but also other subjects as well. Motor skills, motor planning, the coordination, how quickly they can get work done, get it down from the board. Processing speed, also related to motor skills. I'm not going to go through this in detail, but it is important to also acknowledge that many children with epilepsy do fine in school and they have no difficulties from an academic perspective or behavioural perspective. But for others, there are specific difficulties that are related to the kind of underlying difficulties that I outlined on the last slide. the key areas that come through in the literature and from my own work with students relate to reading comprehension, spelling, and particularly maths. And again, the CHESS study looked at reading, and they found, 40% scored below the average in word reading, 17 had a significant discrepancy, 59% with reading comprehension, 46% with spelling, and 54% with maths. So maths is a key area of difficulty. And I have found that with students who may not have dyslexia or may have no reading difficulties, with maths, actually go so far as to say that they have what's known as dyscalculia, a really specific difficulty with numbers. So I'm not going to go through this in detail, but it kind of gives a flavor of the areas of difficulty and how it translates at a school level and at a subject level. The motor skills, again, is one that's often not, really fully understood and supported. Impact on gross fine motor skills, on their handwriting, on their daily living skills. I mean, even tying shoelaces, opening bottles, getting dressed, all skills that are essential to function on a daily basis. What's known as executive functioning. So, the planning, the organization, inhibition of, behaviors, and cognitive flexibility. Okay, so another area that can be overlooked is coordination and kind of physical aspects of it. So specific difficulties in relation to fine and gross motor skills, as I outlined on the last slide, and that translates to difficulty, for example, playing football. And we all know how important that can be for kids, particularly boys, to be able to kick a football around. If you're not able to do that, often you're excluded from, the whole social interactions at lunchtime or sports outside of school. The same with cycling, with PE, even at more specific level, the awkward pencil grip, formation of letters, numbers, balancing, and their speed at which they can get work done in school and even work down from the whiteboard. So it's really important that these difficulties are not, kind of just mislabeled and missed in terms of, oh, he has or she has epilepsy. It is important that they're assessed for dyspraxia or developmental coordination disorder, because it may be a separate difficulty to the epilepsy. So what's contributing to all these difficulties? And again, really quickly, there can be seizure-related factors. So the presence of an underlying brain pathology, as we call it. So there can be global learning difficulties or developmental delay caused by maybe more extensive brain or abnormalities, which I hate that word, but it's the term that's used. Or there can be specific learning difficulties attributed to a more kind of focal brain difficulty. For example, maybe children who have a scar in the middle of their temporal lobe may have short-term auditory or visual memory difficulties. Other factors that are important is that the age of seizure onset, particularly if they're younger when the epilepsy starts. Absolutely the type of epilepsy, and I'm very conscious that today I know there isn't time to spend any time looking at what is epilepsy and the different types of seizures and epilepsy disorders, because that has a huge impact on educational attainment and engagement. Also, the duration and the severity of the seizures, and Danielle gave us a really good insight into that in terms of, that the first 3-4 years of secondary school education, was really impacted by, the duration and the regularity of seizures, and also the treatment, where she was going through changes of medication, and that brings about a lot of difficulties for the person with epilepsy, like the side effects of when you're changing type and dosage is quite can be quite severe and not to be underestimated. And then another area is what we call subclinical epileptic activities. So there can be kind of what's known as subclinical seizures going on. And that could be sometimes children describe a feeling of like déjà vu, or they're feeling that something bad is going to happen, or that they can have auditory or visual hallucinations. And it's a very frightening for them, very overwhelming experience. And there may be no outward sign to the school that this is happening. So other factors then are the kind of the nature and the degree of the cognitive difficulties, which I've touched on. Psychosocial issues. Again, Danielle, you so eloquently portrayed that in terms of standing out, being different at a time, particularly in secondary school, when it's all about trying to fit in and be part of the group. And it can be as extreme as, you know, really leading to bullying. But, you know, other side effects or impacts, factors are in terms of social isolation, being left out of play dates in primary school, and being left out of, you know, activities that kids do after school. Also got to look at access to appropriate interventions and supports, whether that's both in school and outside of school, if they're attending other maybe clinics, mental health clinics, the CHINA or the CDNTs or primary care. Social factors, as I've referred to, inclusion versus integration. I think that's really important, that they may be included, they may be integrated in the school, but are they really included? And we could spend all day talking about that area. Okay, so again, the epilepsy itself can contribute to the difficulties. What's known as a prodrome, the build up to a seizure, and a person can be very irritable, there could be a mood change or behavior change. That could be for a few hours before an actual seizure, or it could be for a few days or a week before. And, you know, they're really not able to articulate that, so people around them don't know that this is happening. As I've said already, sometimes there's an aura that they can feel, like this, like deja vu, a pleasant sensation, and they'll say that they feel like they're going mad. They feel it's very distressing for them. They can have a sensation of a very odd smell, which nobody else can smell. Then there's something called automatism, a state of clouding, where they can start to pluck at their clothes, smack lips, swallow repeatedly. And again, Danielle, you referred to it was Tourette's syndrome. Schools have often said to me, oh, I think they may have Tourette's, but in fact, it's not Tourette's for them. It may be just actually that it's part of the seizure, and they, you know, it's the type of epilepsy that they have, where this is what they do. And again, that can lead to a lot of social isolation and teasing and ridicule and bullying. Then after a seizure, they can, you know, feel very sleepy, very confused. Some people can, you know, they can be more aggressive, concentration difficulties, irritable. And if you think about all of that, and if they're having a lot of seizures, that can lead to considerable disruption, particularly if they're constantly sent home, and they not always need to be sent home. Sometimes, you know, asleep or time just resting is enough. But again, that's something that would be discussed with the school in terms of the particular student's needs. Again, I've referred to those kind of subclinical seizures, which are difficult to recognize and may be mistaken for daydreaming, and particularly absence seizures. I mean, I've seen it over and over again. Teachers and indeed trainee psychologists saying to me, oh, actually, I think it could be ADD or ADHD inattentive, but in fact, it's not. It's an absence seizure that's been missed. So Danielle referred to the medication and the side effects. I won't go through this in detail, but at a glance, you can see it's quite a range. And if, you know, we were to put ourselves in that context and trying to function on a daily basis in our jobs, you know, trying to deal with all these potential side effects, it's quite a lot, you know. So for teachers to say, you know, they're not paying attention, absolutely they're not paying attention because of all of these things that's happening. And here's just one type of anti-epileptic drug, Keppra. If you just look at the side effects there, again, very difficult to function on a daily basis with even one of those, like nausea, dizziness, headache, low mood, anxiety. And they're often underestimated. Yes, we know they're on medication, but what is the actual impact on every day? Okay, coexisting conditions, you know, so yes, some children might just have epilepsy, and that's huge in its own, but there may be what we call comorbidity or coexisting conditions, for example, autism, dyspraxia, intellectual disability, mental health difficulties, particularly maybe anxiety. They may be part of the epilepsy, may be part of a genetic condition or a rare disease, and there may be ADHD. So I'm just going to focus particularly on ADHD because I think it's it's a really difficult combination. Either of them on their own is very difficult for the child and for the school, but together it makes it's more complex. And Riley would have found that 30% of children with epilepsy attending neurology clinics meet the DSM criteria for ADHD. And the children with ADHD and epilepsy, they're likely to have poorer outcomes than those with children with epilepsy alone. And I think that's, you know, it's a very obvious statement, but I think it's important to think about it. You know, the difficulties associated with ADHD in terms of inattention, regulation, behavior are difficult enough on their own. Put that with epilepsy, then of course the outcomes are potentially lower. And those with diagnosed with ADHD that have an earlier seizure onset also have a poor outcomes. Okay, again, really quickly, I'm conscious of time, and I know Clara, you'll keep me on track here. As I said, I could talk all day about this, but you know, looking at, I think we often miss the increased risk for internalizing difficulties and the anxiety and mental health difficulties that can occur with epilepsy. And I feel very strongly about this issue, diagnostic overshadowing. I think that often there's too much put on the epilepsy and, you know, getting the medication right and all of that, which of course is really, really important. But at the cost of not recognizing that there may be dyslexia, there may be dyspraxia, there may be anxiety, there may be ADHD. So that's really important that they are not, as I call it, overshadowed. Additional factors, key factors, but you know, in terms of self-esteem, social skills, motivation, and self-regulation. Self-concept, really, really important. You know, look at this study. At the time of diagnosis, the children's self-concept were typical. As little as 3 months post-diagnosis, they were atypical. And I think, again, Danielle, you're telling your story really highlights how that, you know, how and why that is the case. You know, it's feeling of social isolation, not wanting to stand out, just, you know, that life is, general life is affected, quality of life. Anxiety is very common difficulty. And as I've already said, higher levels of internalizing difficulties, particularly depression and anxiety. And it may be associated with many of these factors. It may be a side effect of the medication. It may be the foci of the seizure, like where that the sensation may be that of a panic attack, depending on the part of the brain that's affected. It may be the aura or the anticipation of the seizure and fear of how to cope with an actual seizure, or it may be the social isolation of you know, not being able to take part in everyday activities. This is just a summary of the kind of the various behavioral mental health difficulties. I'm not going to go through it in detail, but again, it kind of summarizes what we've talked about: behavioral difficulties, anxiety, social isolation, and you know, lower self-concept. This is an area I think is really, really important to give consideration to, and it's that of absenteeism. And there can be a number of contributing factors to it. One of them being, for example, frequent hospital appointments, or if they're inpatient, maybe sometimes for severe behavioral difficulties, or maybe going through, you know, what we refer to as a workup for surgery, or just trying to get medications right, or trying to find out what's going on in terms of the type of epilepsy and the seizures. It can also be compounded by, you know, frequent seizures, maybe before school and they don't get to go to school. And if they're in school and they're sent home too frequently, the side effects of the medication, where they're too fatigued, they have sleep difficulties, and then actually too tired to go to school. There can be behavior difficulties, and linked to that, it can result in maybe reduced days, reduced timetables, which is very serious. And, you know, and if that is ongoing, you know, it really is important that parents and schools are linked in with TUSLA and the Education Welfare Officer to look at, well, what can we put in place here? And, you know, maybe at an extreme end, home tuition. But I think it's really, really important that, you know, children with epilepsy, many are missing out so much of school because of all of these factors, and there's not enough supports put in place. Social inclusion, again, I've referred to this, that, you know, there can be genuine concern over a child's physical safety, but it may actually lead to restrictions of normal school activities, you know, exclusion from At second level, it can be exclusion from some subjects without a really valid reason as to why they can't do that subject. It can also lead to exclusion from, social experiences in terms of school outings and tours, both primary and post-primary. And again, that's quite serious unless there's a very strong valid reason for it. And this increases the child's sense of social isolation and diminishes their self-concept and thinking, well, I'm not normal, so I can't take part in normal activities. And that is, the language that children would say and use with me. So it's really important that, parents and schools advocate for extra support so that they can facilitate their full participation in school. And that unless, as I said, it's a really, really valid reason that they shouldn't do it, backed up by medical opinion, that every effort should be made to ensure that they are fully included in every aspect. Okay, I'm not going to go through this, but it's almost like a summary of the different factors that can contribute. But one of the things here in terms of teacher knowledge and expectations, and sometimes I find it's the other extreme in terms of the lower expectation, and that maybe they're let off homework or they're let off with a lower standard of work. And that's as bad as having too high expectation. But, I really think that maybe there needs to be adjustments at times when maybe a child is going through change in medication or a lot more seizures, but that the teacher expectation, that should not be lowered. And I suppose that's linked to increased teacher knowledge and also school environment and school-based interventions. And related to that is supports. And this can be an area of difficulty that a lot of parents have accessing in terms of what is my child entitled to. Okay, they have epilepsy, but maybe they don't have a diagnosis of dyslexia, but yet they may have specific needs in relation to literacy, for example, reading comprehension or spelling, or numeracy. As we've seen from the research, it's very, very prevalent. So, you might have to make a case to the school, okay, he or she, they're not scoring below that magic 10th percentile, but yes, they need supports, and maybe their attainment is declining, or it's been affected because of, particular things that are going on, but that they, it really needs to be on a case-by-case basis. And the same, then maybe the support should be more around social skills and anxiety and mental health. Exemption from study of Irish. Again, that can be a tricky one. Yes, they need to meet the criteria in the circular. They have to have one literacy attainment score below the 10th percentile. But, again, it's something that often parents have to fight for. And, maybe they're told that they have to have a psychological assessment to back that up. That's not true. The school can now make that decision on exemption from the study of Irish.
Joyce, I'll just give you a 2-minute warning there.
Oh, thank you. Nearly there. Thanks, Clara. Danielle referred to exams, and I just thought she summed it up so well, Danielle, in terms of there's generic supports there. Yes, there's reasonable accommodation, spelling and grammar waiver, extra time, all of that. But that is often not enough for a student with epilepsy. If they have a seizure before they go in or the night before, that morning, they really can't perform to the optimal level during that exam. So it is, it's a clear disadvantage. And it's an area that Epilepsy Ireland is doing a lot of work advocating for, but absolutely there's not enough there. SNA access, again, parents say that it can be very difficult to get an SNA because, if they're not having a lot of seizures in school, they may not have, you can't quantify how many they're going to have in school, so it's really hard. So, often it's around, responding maybe to behavior and other behavioral needs and care needs, administration of anti-epileptic drugs, and particularly responding to seizures if they need buccal-midazolam, and ensuring that there are enough people in the school trained in buccal-midazolam. So these are just a summary area then of the areas to consider. So ensuring that you look at the broader cognitive skills, their language ability, their visual perceptual skills, executive functioning, particularly memory, attention, concentration. You look at their academic skills, literacy, numeracy, attainment, look at behavior, mental health needs, emotional needs, and very important adaptive living skills, or everyday living skills, particularly if there's an intellectual disability. really important that there's also consideration given to the family impact of epilepsy, particularly on siblings, and the whole kind of psychosocial family functioning, and the fact that parents are often so stressed and so tired that they don't have time to fight all of these varying systems that are coming at them. And I suppose in conclusion, that is what I think our goal should be, is to be able to merge the medical, the educational, and the psychosocial issues and services and provision, so that we have a shared language among professionals, and the family and the school, that we're all on the same page, and that it's not just the medical or the education or the mental health, that it's all together. And I just have my email address there if anybody would like to contact me, after this in any capacity or any questions. I'm absolutely delighted to hear from anybody. So thank you.